Well, thanks, Amy. I kind of hate to follow that, but do you have questions for Amy or Diane?
Governor, the plan makes a lot of sense, but I think there's a lot of pushback among regular people about the inmates. Why should a convicted murderer sitting in Walpole get that vaccine before your elderly dad, my elderly parents, people with pre-existing conditions?
So we made the decision early on that we were going to focus on what we considered to be populations that were most at risk. And all the data and all the evidence makes pretty clear that congregate care settings are at-risk communities, no matter how you define them. And I remind people that there are 4,500 public employees who work in the state's correctional system who are every bit as much at risk as the people who are inmates there. And I think from our point of view, congregate facilities are congregate facilities, and we need to make sure that the people who work there and the people who live there, because of the possibility of outbreak and the issues associated with the heightened risk of close quarters and all the rest, that should be a place where we focus early in this exercise, along with congregate care facilities for people with disabilities, congregate care facilities for seniors, and other congregate care operations here in the Commonwealth.
But since the inmates can't leave, why not just vaccinate the staff?
Well, if you don't, first of all, there are people who come in and out of those facilities who are not actually employers there, or employees there. You have lawyers who come in and out of those facilities. You have, in some cases, family members. You have other advocates who represent the people who are in those facilities. And I don't think you can draw a bright line that says you're only going to vaccinate one half of a population and not the other, when in fact there are other people who do come in and out.
So I want to just follow up on that. If I understand correctly, it's all wrong.
Say again?
It's all voluntary for the prisoners?
Correct.
Do you have a sense of how many plan on taking the vaccine? And if it doesn't seem significant, what's the plan?
Well, first of all, we don't know at this point how many people will take it. What we do know is most of the folks who are in congregate care operations, whether they work in them or they live in them, have expressed tremendous interest in this. I think Amy's comment about the fact that so far in the first site they did, they had 100% participation, and Diane's comment about the fact that the family members associated with the people that she serves can't wait, is a pretty good indicator that for those folks in particular who have seen what happens in congregate care facilities when this thing starts to run, I think there's certainly a heightened awareness. And while Massachusetts has done, I think, a very good job of managing outbreaks in our own congregate care facilities, we've had some outbreaks that have been pretty dramatic. And again, it moves, and it moves fast when you're in a congregate care facility. That's just a fact.
Governor, are we still on track for phase 2 starting when you thought it would be starting at the beginning of February? Are the other phases still pretty much on track?
If the vaccines arrive as they are anticipated to arise, and I said yesterday that we don't get a lot of long visibility into when the next doses are going to show up. If they show up when they're expected to show up, then yes, phase 2 will probably start at or about the same time we anticipated.
Governor, I'm hearing some
explain the lag time. We get a lot of questions. The lag time of the administering of the vaccine. And then do we have a percentage of how much has been administered so far of the doses, just in general?
I think it.
Running about halfway, or?
I think the number is about 50%. But the thing to remember here is it's not like we did not get 400 and how many, I can't remember the exact number. Whatever that number was I gave you in my remarks, we did not get that on December 28th, right? This stuff comes in batches of like 40 or 50,000, 75,000 with a couple of days lead time on it most of the time. And we then work to fill in the distribution channel as they become available and make sure that they get used before they reach their expiration date. And every provider that's involved in storing this stuff is required to tell us if they have any issues associated with lost vaccine. And I mean, so far, no one has told us that they were unable to use the vaccine that they had.
Governor, is there any guidance?
I think Secretary Summers has explained that maybe it was on that background as well. What is the reason for the lag time, the weekly report, or how much it's actually benefited?
I think of it as basically a reporting issue more than anything else. I mean, hospital organizations, healthcare organizations, the provider groups that are working on this stuff, you know, they are doing the work that they're doing to vaccinate people, and then somebody at some point is going to take that information and load it into MIIS. But there has been a lag. We're not, and by the way, we're hardly the only state that has a lag between the point in time at which somebody gets a shot administered and the point in time when it shows up in somebody's database at the state level. That's true in many states, and it's usually a couple of days.
Governor, is there any
New York Times are tracking sort of how we're doing compared to other states, and they say that we are above the national average in terms of how quickly we're administering the shots, but behind in terms of coverage and population. Are we middle of the pack here? Are you satisfied with that? What's your response?
So we have a protocol, and the protocol starts with life, risk, and healthcare system capacity. That's kind of where we drew the line when we established where we were going to start with this. And everybody who's in our targeted categories, one way or another, falls into those particular grids. The third piece of it was to make sure that we were dealing with equity questions as we developed those early points of access as well. Now, we're doing the best we can to stick to that because we believe that's the best way to be quote-unquote fair with respect to how this works. Start with the people that are most at risk. Start with the people who service the healthcare system that's so important to our ability to make sure we take care of people who get sick and deal with some of the issues around equity that have been so present in this from the very beginning. There are other states that have much broader criteria that they're using coming out of the gate on this stuff, and that's their call. But if you don't work in healthcare and you don't work in long-term care and you don't work in congregate care and you're 25 years old, in Massachusetts, we don't think you should be part of what I would describe as the most pressing categories for getting vaccines. There are other states that have different policies with respect to that.
But what about those over 65? I mean, they are recommending that states immediately vaccinate those people. Any more thought about that?
We haven't actually received, there's been a lot of media about the 65-year-old question. We haven't received like a bulletin or guidance or an advisory from the CDC on this yet. Once we get one, we'll obviously give it to the group that Paul Bittinger chairs, which is the group that we've been relying on for guidance with respect to our own protocols, and follow whatever kind of advice we get from them. We did move the 75-year-olds up into the second category based on the feedback we got from Paul and his folks after we got the guidance from the CDC.
Governor, what's the guidance? Mass vaccination second Western Mass?
We're working with several folks. We now have what I would call a template that we developed with the folks at Gillette, and we are now in live discussions with folks in other parts of Massachusetts about using that template in other locations, and I'm hopeful we'll have more to say about that in a day or two.
Governor, any guidance about vaccinations for prisoners that might end up in solitary confinement or otherwise might not be with the rest of the population?
My guess is that everybody who's there is going to get vaccinated. Sort of everyone, yes, everyone will be offered. The decision about whether you take it or not is obviously up to people on an individual basis.
Governor, one thing I saw in Arizona was they have the football stadium opened up. They're doing it in the parking lots. It's quick. People drive through, you get the shot, show your credentials. And if there's a lull, anyone can drive up and get vaccine. And they're hoping to do 10,000 a day. Is that the type of thing you're thinking about for Gillette?
I really hope, and I know this isn't popular, but I really hope that early on we are able, with the vaccine that's available, to hit the populations for whom life is most at risk and for whom the healthcare system relies on and depends on to provide care. I do know that in a lot of states, people who are the same age as my kids have gotten vaccinated before people who are home health workers or healthcare workers or long-term care workers or long-term care residents or some of these other populations, or people who have multiple comorbidities and over the age of 70. Honestly, I just don't think that's the way we should do this. I think the focus early on should be on those who have the most to lose, or who are fundamental to our ability to take care of those who have the most to lose. And remember, if all goes according to plan and we do end up with the kind of distribution that the feds project will be occurring if you get out 60 to 90 days from now, then we could be in a position where many of the kinds of places that we're talking about with respect to vaccinating people could be running at a very significant clip, the so-called flywheel that I've talked about, and you could get into a lot of those populations that don't have any, me, the lieutenant governor, folks who don't have any of the criteria that are sort of fundamental to this thing.
So do you think eventually, once we get beyond the stage you're talking about, it could be like that, a big parking lot?
Yep, absolutely.
Quick, boom, boom, boom.
Yep.
Governor, you mentioned the legislative administrative template. Do you envision that being a 24/7 operation so that people could just drive in the parking lot at any time and get vaccinated?
I think that's certainly possible. It's going to depend on three things: staff, demand, and what the folks at Gillette or at one of these other sites believe they can accommodate.
Governor, you have a bill on your desk, climate change bill. I'm not asking you where you stand on it, policy on that thing. How frustrated are you that you either have to omit, prove it or veto it? How frustrated is that? Because there's word out here in the administration that people are concerned about elements of that.
Every year, not every year, every 2 years, right? We come to the end of the legislative cycle, and I get the fact that complicated issues play out in a variety of ways. I mean, I remember at the end of the first session, after we took office, we were all biting our nails over whether or not the energy bill was going to get to our desk before the end of the formal session. And it was incredibly technical and incredibly complicated, and because of the procurements associated with wind and hydro that were in there, as well as some of the other elements and the federal rules and all the rest, the thing had to be written in a very particular way, and the three chambers conversations about this literally went down to the last minute, and eventually the bill got to our desk and we signed it, all right? At the end of the session 2 years ago, we were back and forth with the legislature to the very end around Airbnb. We called the Airbnb bill. It was basically the legislation around home rentals and that type of thing. It came to us. We hadn't quite gotten to the end of the negotiation. We sent it back amended. Now, they're not in formal session anymore. So at that point, we have to get everybody to agree on whatever it is we end up with. And we spent a ton of time working the thing sort of offline, and then eventually managed to get a bill done that worked for cities and towns, that worked for the industry, and worked for the Commonwealth. And it passed in an informal session without a formal vote, because we could do that. But you can't always write the ticket about how this stuff's going to happen when you get to the end of the process. At this point, we have two choices. We can either sign the whole thing or veto the whole thing. I would prefer to play this game in a way that's more consistent, for example, with the way we played the police accountability legislation. But, kind of is what it is. And I get the fact that sometimes stuff just doesn't get there until you get to the end. But my point being, this is an unusual year with COVID and everything else. I mean, just swearing in the new legislature for this session, I got a little bit of a sense of how difficult it's probably been for the legislative leadership to manage debate and discussion in this kind of environment. You know, everybody was broken up into divisions. There's people on the screens. I mean, especially when you're thinking about the 160 members in the House. So, you know, the fact that this thing ended up at the very end of the session, it just did. And like I said, in other sessions we've been able to work our way through the margins and the edges of this. It was a lot more complicated this year because of the COVID stuff.
Are you going to sign it?
We're still reviewing it. We have 3 very big bills. You may have noticed we signed or vetoed all the simple stuff that was on our desk that was fairly easy to get through in a pretty short period of time. We still have 3 very big bills on our desk that we're still working our way through. The transportation bill, the climate bill, and the economic development bill. And we know the clock's ticking, and we need to make decisions on all 3 of them this week.
Governor, why cases that are identified to a cluster, a lot of cases identified to a cluster, are being linked to child care. I'm curious what you have to say about that, and whether that could mandate prioritizing those people who work in child care for the vaccine based on what the reports are saying.
We're working through the priority categories that we were provided by the committee that Paul Bittinger chairs, and we have continued to discuss the possibility of moving people on those lists based on sort of new information and have updated the guidance. And that's certainly one of the categories that is currently under discussion. And people have moved based on those discussions with the committee.
Any update on security with the declaration as far as National Guard?
So there are 2 issues associated with the Guard. One of them has to do with Washington, and that's really the one we're focused on at the moment. We have had, and I would imagine this is true for many states, especially those on the East Coast, we've had an ask from Washington to support a fairly significant request for Guard personnel in our nation's capital, and we're currently processing that. But that's been the primary source of most of that discussion so far. We continue to talk to all the people who are part of this. We had a call this morning, the Lieutenant Governor and I did, with Secretary Turco and with feds and with our own people about anything associated with what's going on here. And the answer here remains that there are no, at this point in time, what we would call known or credible threats in Massachusetts. But we are talking about a request from D.C. with respect to Guard personnel supporting their efforts around the inauguration.
Governor,
last week after the siege on the Capitol, you said that you thought Donald Trump should step down as president. Do you believe now that, do you now support the second impeachment of the president? And how do you get from, the past 2 years of how you think he should step down? But if you do support impeachment now, how to get from there?
I said at the time that I believed that Vice President Pence should be empowered to manage the transition to a new administration. And I continue to believe that. I also said that there were a number of means and mechanisms that were available to deal with that at that point in time. Since then, several have been taken off the table, and the only one that's left at this point is to move forward with an impeachment proceeding. I still want Vice President Pence to be worrying about the day-to-day between now and the transition, and anything that might have to occur after that as the two administrations try and figure out how to make these handoffs, especially the handoffs around all the stuff associated with COVID, as clean as possible. I mean, just spend a minute on the COVID thing, okay? Guidance from the CDC about various populations. All kinds of vaccines that are currently in process to receive an EUA that don't have one now. AstraZeneca's in there, J&J's in there. We have a long discussion that's been going on for a couple days now between the White House and the task force on COVID with states and with CVS and Walgreens around distribution plans. And this whole question about whether you go all in on everything you've got and just assume you're going to have second doses available for people when you need them, or continue to pursue the policy that's been pursued up to this point, which is to make sure they hold on to enough vaccine so that they can guarantee they can deliver a second vaccine in the 21 days or 28 days that are required. These are really big issues. They're really big decisions. They're going to last way beyond January 20th. And you talk to anybody, any governor, and I've been on a bunch of calls with governors on this, or you talk to any of the folks in the health and human service world or any folks in the healthcare world, they want that transition to be as seamless as possible so that people can plan and be able to make sure that what they hear right up until January 20th is exactly the same trajectory that everything's on from January 21 forward. So from my point of view, anything that makes sure that we have a very clear and very precise and very organized and coordinated transition, especially around these issues, is going to be critical to dealing with what you all have talked about as the bumpiness that's been associated with this rollout in the first place, right? I mean, I don't want this thing to go from here to here in the course of a couple days because a new administration takes office, okay? We really need this transition to be as clean and as coordinated as possible, especially around all these issues that are associated with COVID. There's also a whole bunch of rapid tests that are also in the EUA process right now. Now, I have full faith in Rochelle Walensky to be a superstar in that position, but as I sit here, I can't remember if she has to get confirmed by the Senate or not. I don't know. I mean, so this is why I think it's really important that this issue be joined and dealt with.
Should President Trump get a chance to run for president again in the future?
Well, I didn't support him either time he did run, but the rules of the game associated with that are not something that, I make decisions about. I mean, my preference would be, obviously, for other candidates.
Thanks,
Can
everyone.
I follow up on the National Guard comment you made? I didn't realize Guard from other states were heading down to Washington. How many are we talking about from Massachusetts? And do you envision Washington being just like an armed camp for the inauguration?
I don't know anything outside.
How many are we asking for in Massachusetts?
A few hundred. So I don't know what the rules are with respect to what might be coming or what the expectations are for other parts of the country. And remember, sometimes when they ask for very particular kinds of Guard personnel who have particular skills and experience, and that usually means that they take big numbers from some places where they have the kind of people they're looking for and not so much from others. So you really shouldn't generalize whatever the Massachusetts ask is to everywhere else, because that just, it doesn't work that way.
If we needed them, we could say no.
Pardon me?
If we needed them, we could say no.
Correct, but, honestly, a number like that in the grand scheme of things is, I mean, we're processing the request, but it's an eminently manageable number.